Hello, everyone. Thank you for joining us here today. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation. CPBF is a charitable organization, and our mission is to support and educate families of premature babies. This Premi Chat series is one of the many initiatives we have to bring information for NICU families and healthcare professionals. Here, every Friday, we talk with experts, researchers, and parents who share with us their experience and knowledge. Also on our website, canadianpremis.org, parents will find all kinds of resources and support. And we're still offering the COVID care program for families who are currently in the NICU up to a year post-discharge. We are offering free therapy sessions with perinatal mental health specialists from around Canada. And you can apply for that program visiting the resource page on our website. It's a very simple form. And today we are going to talk about what has happened to fathers in the NICU during the pandemic. This presentation will share the findings of an international study undertaken to learn about the experience of fathers whose baby required neonatal intensive care during the COVID-19 pandemic, limitations on fathers' access to the unit, their worries and source of stress, as well as their involvement in infant caregiving will be presented. I have here joining me live from Montreal, Dr. Nancy Feeley, who is an associate professor at the Ingram School of Nursing at McGill University and senior researcher at the Lady Davis Research Institute of the Jewish General Hospital in Montreal, Quebec. Her research focuses on the psychological adjustment and parenting of mothers and fathers of newborns requiring neonatal intensive care. This work is relevant to the current preoccupations of neonatology, the central role of parents in their infants' care, and promoting parental mental health. Dr. Feeley, thank you so much for joining us here today.
Good afternoon, Fabiana. Thank you very much for the invitation. It's really my pleasure to be here.
It's wonderful. So I know you have a presentation to share with us. I will let you share your screen. And for all of you watching us live from YouTube or Facebook, please send your questions and your comments on the chat box below your screen, and we'll be addressing them after Dr. Feeley's presentation.
Okay.
Okay, I don't see your slides here.
Did my share screen.
Okay, let's try once again, see what happens there. Go on the share button at the StreamYard. Otherwise, I can control your slides from here. Let's see.
Yeah, it's okay. It's just not. The window, right, Fabiana? And share?
Yes. And then your slides should be there. Oh, here you go. Okay, let's put this. Okay, now you can just go on play from beginning. Perfect. The floor is yours.
Yeah, thank you. So welcome everybody. Thank you for attending. I'm here presenting on the behalf of an international team of investigators. We call ourselves FCAN, and we got together in 2018 under the leadership of Duncan Fisher, who is a nonprofit organizer in the UK, who's preoccupied with the needs of fathers in worldwide. So he assembled a group of us, and we put together a sort of review of the evidence on fatherhood in the context of a neonatal hospitalization in 2018. So we, my colleagues and I, researchers and clinicians from around the world, are aware that for more than 40 years, we've had evidence about the importance of fathers' involvement for their child's social, emotional, and cognitive development, and that fathers aren't just contributing the same kind of input to their children as mothers, but in fact, they make some special contributions that are very important to the development of their children. And that the benefits of father's involvement are not only for the child, but also for the father themselves. So everybody, I'm sure, is aware that with the COVID-19 pandemic, there were actions taken on behalf of many units across the world to limit the presence of parents in the unit. There were obviously, I'm sure you're all aware, concerns about the safety for the infants, for the family, for the staff. There were concerns about the availability of protective equipment for staff and for parents, the desire to protect staff from infection in order to have adequate numbers of staff in the unit to care for the babies, and of course wanting to protect the infants themselves from infection. Now, policies unfortunately vary greatly, surprisingly, across units within countries and across countries. And this was very confusing for everyone, especially for parents, to understand why that might be. As a group, my research group was really concerned about what was going on with respect to fathers' access, because in some cases, mothers were permitted access to the unit as usual, but fathers were restricted from being present. So we were concerned about many different stressors that fathers might face in the context of the pandemic: separation from their infant, separation from their partner, getting access to information about their infant, and participating in medical decision-making, which we know from research is a very important part of father's role during the hospitalization. Concerns about older siblings at home, decreased support from extended family and friends because they were unable to see them and to spend time with them. Concerns perhaps about even commuting safely between home and hospital, and also financial challenges that might arise because of their own employment and the pandemic in general. So in last summer, in June, we got together, the Finesse group, and we published a paper in BMJ Global Health that described our concerns about these restrictions on fathers, mothers, and babies. And we're really concerned that this was perhaps a very backward step in the efforts across the world to improve fathers' engagement, experience, and enjoyment of their infant during a NICU hospitalization. So with those concerns in mind, we actually then got together to mount a study, which is called a survey of fathers. And this is the team that came together. Again, it's the Finesse team. And Esther Adama at Edith Cowan University in Perth, Australia, was the lead in getting us together to mount this particular study that I'm going to tell you about today. And we collected data between July last year and April this month, but most of the data was collected last year. Now, we used a survey questionnaire that had been developed in the United States by a large team of clinicians and researchers who were concerned about the impact of the pandemic on mothers and fathers in childbirth situations. And what we did was we adapted that survey tool for the neonatal context. And this will allow us going forward to look at the experience of fathers in the NICU context compared to fathers in other childbirth contexts. So what did the survey ask fathers about? Well, we asked them about a lot of different aspects of their experience. First of all, what was it like for them to be experiencing COVID? And what was their firsthand experience with either diagnosis themselves, their partner, family members? What restrictions did they have to deal with, if any, during their infant's hospitalization due to the pandemic? What was their involvement in infant caregiving during their infant's hospitalization? And we also asked them about their worries during the hospitalization and what sorts of things they were worried about. We also asked them about signs of stress that they might be experiencing due to the pandemic or due to their infant's hospitalization. Other questions asked about what support was available and other resources to them in the NICU during the pandemic, and preparation for discharge and any support that they might have had after their baby actually went home. So today, what I'm going to do is the survey asked about a lot of different aspects, as you can hear, and given that I only have a brief time to present to you, I'll be focusing on those top four topics that you see at the top there. So we had 129 fathers from 13 different countries who participated in the survey. You can see that for the large part, 39% of them came from the United Kingdom and 22% from France. Now, the UK was especially restrictive with respect to access of parents to the unit. So in addition, some of our key team members are clinicians and researchers from the UK. So they were quickly, readily able to mobilize fathers to participate in the survey. But indeed, we have fathers from 13 different countries, but they're primarily from the UK and France, with North American fathers and Italian fathers also, other predominant groups. So we see that of the fathers who participated, half of them were between the ages of 18 and 34. For almost 60% of them, it was their first child who was hospitalized in the NICU during the pandemic. And virtually all of them were married or cohabitating with the infant's mother. About half of them had university preparation or more, and almost all of them, almost 90%, were employed full-time before COVID occurred. If we want to look at their infants, about half of them, the infants were born weighing less than 1,500 grams at birth, and 30% were 28 weeks or less gestational age. And most of them, 70% or more, were singleton births. So now we'll turn to the first topic that we asked them about, was what was their exposure to COVID, and did they or their partner or the infant experience any symptoms or a diagnosis even? So what you see here is that there were only 2 fathers who actually tested positive themselves, who participated in our study. One mother had tested positive, and one infant had tested positive. So in fact, of these 129 fathers who took part in our survey, very few of them, almost none of them, had any COVID diagnosis themselves, their partner, nor the infant. Now, what about their exposure to other family members or friends? A small number of them, 5%, had had contact with somebody who had tested positive. Almost 11% of them had a family or friend who was hospitalized, and 5% of them had a family member or friend who actually passed away during the pandemic, during their infant's hospitalization. So what happened to them in the NICU? So here's a very important piece of data, and this was the question that asked about what restrictions they were facing with access to the unit and contact with their baby. So in this case, there are 129 fathers that participated in our survey, as I explained, but more than one of these restrictions may have applied to the situation of some of the fathers. So what I want to point out is that there were 20%, almost 20%, who had no restrictions on their access to the unit and to their infant. However, 28% of the fathers who participated, the case was that only the infant's mother was permitted into the unit. So therefore, the father was not allowed access. Others faced somewhat less restrictions, but there were things such as having a fixed amount of time that they could be present in the unit, for example, 3 hours, or 2 hours, or an hour, or limited time of the day that they could be present, for example, only on a day shift. Some of them, 20%, were allowed only 1 entry per day. In other words, you could only come into the unit once during the course of the day. And if you left, some of them were not able to return. So you can see that there were many different restrictions that were enacted, and in 18% of the cases, fathers did not have any restriction, but 28% of the fathers who we surveyed, in fact, were never permitted into the unit. Now, what about access to the unit and for other family members, grandparents, for example, and other siblings of the child, should they have other older siblings? Well, you can see that it was very, very common for other family members, siblings, and grandparents to be permitted access. So you see that 94% of the fathers reported that grandparents were not permitted in, and about the same amount siblings, the same thing. We also asked them about when they did enter the unit, if they could, what did they have to actually wear with respect to personal protective equipment. So you can see here that the vast majority, almost 70% of them, had to wear a mask when they entered the unit. Almost 20% of them had to wear a gown, and then gloves were required by a smaller percentage, but 10% of the fathers who entered the unit needed to wear gloves. Now, another important question that we asked them was, for those who were actually allowed access into the unit, what kind of involvement were they having in their infant's care? So I want you to remember that there were 28% of the fathers who participated in our study who were not able to enter the unit. So this is probably responses from those who were actually able to be in the unit. Although access might have changed over the course of some of the baby's hospitalization too. So you can see that 72% of the fathers reported they were able to talk to their baby, stay close to the incubator, change diapers, a smaller percentage actually having skin-to-skin physical contact and able to hold their babies. Some of the fathers, about half of them, were able to feed them, and a smaller portion were actually able to bathe or assist during procedures. So that describes what involvement in caregiving fathers were able to engage with in during their infant's hospitalization. Now, you'll recall we asked them about their worries and how worried they were about different issues during their baby's hospitalization. So by far, and you can see here in the graph, I'll just explain, if they were always worried about something, you can see that percentage here in blue. Sometimes, or most of the time, worried about something was 25% here, or 25 fathers, sorry, and half of the time. So if you look at whether they were always worried, most of the time worried, and half of the time worried, then I've stacked them up here to tell you sort of just the extent to which fathers had these concerns rather. So for most fathers, the usual worries about having a baby in the NICU was the most prevalent worry that they had. And you can see that that's true for almost 80 of the participants in our study. The next large area of concern was about infection and bringing infection into the unit themselves, being the person or the source of an infection into the NICU. They were concerned about healthcare professionals themselves being infected and what the consequences of that might be. There were concerns about the mother acquiring COVID infection if she was in hospital and exposed to people there. COVID infection becoming an issue in the particular NICU was also a common concern. And then to a lesser extent, there were concerns also about, family and friends and just the same kind of concerns that all of us have had about whether our family or friends might become infected. Now, the next topic we asked them about was signs of stress that they were experiencing. So we asked them about sleep problems, things such as difficulty getting to sleep, difficulty getting up when they needed to get up in the morning, having nightmares, having gastrointestinal problems, difficulty remembering things, having sort of being, a little bit labile mood-wise, headaches, dizziness, and crying. So these are all signs of stress. And what you can see here is that sleep problems were really, really common for the fathers. So 37% of fathers reporting difficulty getting to sleep always, most of the time, or half of the time. So we can see that between difficulty getting to sleep, difficulty awakening, and nightmares, that the issue of sleep problems was quite common amongst fathers during their baby's hospitalization. And the other issue that was also quite common was having mood instability. So that would be things like being feeling down or being crabby, for example. So this is just really a snapshot of the findings that we've arrived at with this survey of fathers from 13 different countries around the world. We'll be addressing many different questions. Right now, we're in the middle of analyzing our data and looking at things such as what is the association, for example, between restrictions that fathers encountered and sources of stress or worries or their mental health during the COVID pandemic and their infants' hospitalization. Now, I think we all need to be cognizant of what has been described as ripple effects that may occur because of these restrictions that were placed on parents and fathers in particular with respect to their presence with their infant and their partner in the unit, and the difficulties that created for our families, and the long-term effects, or the short-term and the longer-term effects of what they've had to deal with in addition to the pandemic and their infants' hospitalization. We know that the GLANCE network has been very active in assembling a large group of organizations worldwide to support the Zero Separation campaign to keep preterm and sick babies close to their parents. And I think we need to all pay attention to this campaign and try to do our best to prevent separation of parents and infants. What do we need to do going forward? We feel very strongly that there needs to be an evidence-based approach to decisions about parental presence. We're at a very different point in the pandemic now. We have data about what has happened with respect to exposure of parents and infants to COVID, and how to protect ourselves and the infants from this virus. So we need to use that evidence that's been gathered and is now available to us to make informed decisions about parental presence and how and when that should be restricted, if that's even necessary. We need to also make decision makers aware of the balance here between the evidence about infection control and prevention and the evidence about the importance of parent-infant proximity for infants and for parents also. And I feel that that's really been something that's neglected in the decision making, that we do have solid evidence on the importance of it for the infants and for the parents, and that needs to be factored into any decision making that goes on about access of parents to units during a pandemic. Policies that are developed need to be communicated really clearly and transparently to families with a rationale for decisions. And I've seen in a recent publication that occurred just this month that one unit in the United States had a practice of having weekly telephone calls with families, each family individually, to explain what the current policies were and to have a discussion with them on how they were going to be operationalizing them and the rationale for those decisions. Clinicians need to be acutely aware of the additional stressors that are faced by fathers in particular, and be on the lookout for some of those signs of stress. And our study is showing that sleep disturbances in particular may be something that is really common for fathers to be experiencing during the course of their infant's hospitalization in a pandemic. And I think we need to be very, very creative to innovate and to provide access and support to all parents, but to fathers in particular. And again, I think there are some very innovative and creative approaches that are being used to keep parents in contact with their infants and to have other family members, extended family members and siblings, having some access to the infant, even if it is virtually, during the course of the pandemic. I'm an advocate of the use of technology, but only a very purposeful use, not as a replacement for direct contact. but there are some ways that we can be bringing siblings and other family members in to support parents and to have some contact with babies during the course of their hospitalization. And these are some of the ways that we can innovate and avoid some of the ripple effects that we might be seeing due to the pandemic going forward. I want to thank all the fathers around the world who took time to participate in our survey, probably during the time that their infant was in hospital or perhaps shortly thereafter. We really appreciate your taking the time to share your experience with us. And I want to thank the Canadian Premature Babies Foundation for all their accomplishments and the resources that they have been providing to parents, mothers and fathers during this pandemic. It's really been remarkable that you've been able to augment all of that, and I know that parents must appreciate it greatly. Thank you.
Okay, Dr. Feeley, thank you so much for joining us here today. Also, great information. You touched so many important points for families, and it's hard to believe that almost a year and a half later, the restrictions are still in place in many hospitals around the world, and also here in Canada. We still have a unit in Ontario who has a 3-hour visitation policy for families when we know the families are not supposed to be seen as visitors. That's where essential caregivers in the NICU. So thank you so much for that, for this enlightening presentation to really show what happened to fathers, their experience, and what is still happening, and how can we change that. I really appreciate some of the recommendations you gave, but I want to touch a little bit on the technology piece, because this is something that obviously technology, as you mentioned, would never replace parents, but it could enhance that connectivity with the families, bring the siblings into the contact of to meet the brother or sister who was just born, or the grandparents. So there are benefits, we know that, but not as a replacement. What have you seen with your experience for the last year in terms of technology? How it's being used? And is this something that we should be conscious that we cannot be super comfortable on that environment, right? Because parents are essential in the ICU and not use technology for everything.
No. So when I'm talking about using technology, I've seen some descriptions in recent papers that have appeared about, having, for example, parents participate in rounds or having meetings with the physicians virtually. I'm not talking about being present with your baby virtually, just to be clear there. So parent support groups, father support groups, for example. The SCBU dads in the UK, Matt Cray and his group of dads, very quickly, once the pandemic struck, they were meeting on the unit and having pizza night and this kind of thing. Well, they very quickly switched and had it virtually, but they were able to continue to provide a community of support to one another virtually. Parent education and support groups that occur in units too. So they may not be meeting face-to-face in the unit right now, but they're happening virtually. So I'm thinking about those kinds of things. Visits by or contact or experiences for grandparents and for siblings, those could be done virtually. If parents are in the unit, maybe the siblings and the extended family, your friends and your neighbors can't come, but they could be having some kind of connection or interaction with you and your baby when you are in the unit. So those are the kinds of, I think, innovative things that I've heard about that could be taking place using technology.
Absolutely. I agree with you 100%. And I've seen across the country many units doing like a really good use of technology, not to replace the parents, but really to enhance that piece. And to be honest with you, I wish when I was in the ICU 9 years ago, I had this technology available, so my parents in Brazil could see what is happening in that ICU here, because they could not be here for the 5 months we were in the NICU with Gabriel. So I think obviously, I think it's the balance for how we're going to find the balance and is still make sure the parents are essential caregivers. I actually share on our chat a publication that we work together with the International FCAN group. There is a lot of evidence and also recommendations on how to keep parents in the unit with their baby in a safe way. So I think it's very important that we keep that in mind. And I also shared the link of your survey here on the chat. We have a comment here from Sarah. Let me put here on the screen. We spent 54 days in the NICU here in Barrie. We are allowed only one parent at a time from 9 to 9. If you leave the unit, you were gone for the day. It made it so difficult because mom and dad weren't able to be together with the baby. Only when being discharged, you could be together. PPE of a mask was always on, so you couldn't even kiss your baby. My husband struggled because he didn't feel comfortable doing tasks with our prim without me there. We both understand and respect the rules. Thank you, Sarah, for sharing this with us. Sarah is always here on Fridays with Baby Local, and we're so grateful that she always contributes to this conversation. And I think it's very important that families share with us.
Yes, Sarah, you make me want to cry when I hear that, because that's clearly been a very difficult challenge for you and your partner. And yes, I'm very sorry to hear that. But, there are ways for families to recuperate and reconnect despite the challenges that COVID has presented you with. And I can see that, for fathers, that near discharge time is an important time for them to consolidate some of their skills in the presence of, the staff who can support them and the mother who can support them in that. And that's with these kinds of restrictions. That's just a great example of some of the ripple effects that are taking place that we need to be very cognizant of.
So we have another same restrictions here in Quebec from Nina, and we know, Nina, that it's being ongoing across the country. And we had stories from parents who had a baby in one province, a baby got transferred to another province. There were border restrictions. And this one particular family who lives in the northern Ontario, the father did not meet the baby until the discharge day because they couldn't cross the provincial border. So those are the stories that really made us PBF advocate for families, because this is absolutely unacceptable. Because we have to see, there is obviously always going to be careful with COVID, the transmission. We all understand that. But there is also a long-term consequence and impact on families. And sometimes you mentioned a little bit on your presentation about the relationship between the parents once babies get discharged, because one parent experiences an ICU 100% with the intensity, the emotions, the overwhelming feelings, the smell, and the other parent didn't. So now those two parents are trying to parent that baby, one understanding the fragility and the impact, and the other one just heard as a second-hand person on that experience. So how do we build on that, Dr. Feeley, after the discharge?
Well, that's a very interesting question, and I'm sure many couples are being confronted with that after discharge, and they will have had, you're right, vastly different experiences. And so perhaps have differences of opinion or understanding about how to proceed with some decisions they're making with respect to their infant's care going forward. And I think that, obviously open communication is important between mothers and fathers, respecting one another's perspectives too, and knowing that the other person probably had a very different experience, and trying to understand and appreciate that different experience and perspective. But and this all has to take place in the context of the larger pandemic and what we're all living. So yes, I'm hoping that people could have reached out to your support, resources that you're providing, and perhaps to other support resources that are available through their follow-up clinics and community health services as well.
Absolutely. There are resources available. It's just how we're going to tap into those resources. Yes, at PBF, we have a lot of resources, but there is always a social worker in the units that can help to find support in the community where you live. Dr. Phil, let's talk about the flexibility of the unit, because we talk about different units have different policies, different protocols for families, visiting hours that we want to stay away of the word, but that's how they are still putting out there. And then I love this fact that this one unit in US actually communicates to the parents their policies. But right here in Canada, there's different protocols, even in hospitals across the street from each other. And we know that stories came to us. And we also heard stories of babies who were in palliative care that only one parent could be with the baby when the baby was passing. So how can we be flexible enough to allow families to be present together during these very difficult times? Another day I saw on Twitter this doctor from, I think, one of the Latin American countries, because he wrote in Spanish. He said both parents were positive, COVID positive. The baby was passing, and the unit allowed both parents to come and say goodbye to the baby. And that really brought tears to my eyes, to bring that human back into the unit, into the system. So how can units bring that back so they can see the stress of parents in very difficult times?
Mm-hmm. Yeah, and it all depends on who's making the decisions and trying to influence decision makers, I think. And so NICU leaders, nurse managers, department directors, I think need to be interpreting the needs of their population to the people who are making decisions in the institutions, because you can't be treating adult hospitalized people the same as newborn infants, and I think perhaps it's a little, I'm guessing, easier in a pediatric institution to have more family-friendly policies in place, because there's more of a culture and more knowledge. But I think the units that have more difficulty are those that are, units in adult settings where they just don't understand the pediatric patient or, hospitalized child or infant, and the importance of the context there of the family. I think there's more of a culture of family-centered care, family-centeredness in pediatric institutions. I may be wrong across Canada, but I sense that, perhaps it's been a little bit easier there. But I think for all of those departments, it's up to the leadership of the unit to really advocate on behalf of parents and babies, and to make sure that everybody who's making decisions about these restrictions and policies be well informed about the evidence of the importance of parents, mothers and fathers, with their children.
Absolutely, this is so important. And I think you did point something very important, the difference between pediatric hospitals who are used to have families in a different way than the adult hospitals. But it's still is for us to see what's happening, because there are some hospitals in Canada that never change the policies. So mom and dads are always present on a 24-hour period. And I think it's up to every hospital and the leaders to learn how did they do. How are they doing that in a safe way with no outbreaks of COVID in their units? So I think if there is also a willingness to learn from one another and to really be a champion for families, to keep the families together, because we know the long-term impact from the NICU on the mental health of the parents. This is well studied. We absolutely know that, and we can only imagine what is going to be with the pandemic, with even more restrictions and stress for those families. But Dr. Feeley, what is next for you? You did this research, you have this survey. What is the next steps, and where are you going from here?
Yeah, well, we'll be looking very closely. We just had a team meeting at 6:30 my time this week. Challenges of international teams working together, but we were all online to begin to look at this descriptive data at this point, and to raise questions about, so what are we going to be looking at, and I said that at one point in my presentation, I believe, that the questions such as, so we know about what restrictions fathers face, but how do those restrictions rate to the types of stressors that they experience, the level of stress and distress that they experienced? What happens after they go home? You know, you talked about that couple who had different experiences there. So did they get support? What support was missing? So there are many questions that we can continue to pose of our data and share with the wider research and clinical communities through publications and presentations that'll be forthcoming.
That is great. I'll be happy to have you back here to share with us the next step. Dr. Feeley, thank you so much for joining us here today. Always a pleasure talking to you and hear from your experience, your expertise. We really appreciate that.
No, absolutely my pleasure, Fabiana. Thank you very much for the invitation.
Thank you. And for all of you watching us live from Facebook on YouTube, thank you so much for joining us here today. Next week, I'm going to bring two fathers with two different experiences here on our live chat. So join us 1 p.m. Eastern time. And all the past sessions are available on our website on Canadian. Let me share here the link, canadianpremies.org. You can access all past sessions. I want to thank AbbVie and Water Wipes for their ongoing support of our education sessions. And we are a charitable organization, and we believe that through education and support, we can empower families, ensuring they're ready to care for their baby. Visit our website, canadianpremies.org. Together, we can create a brighter future for all families of NICU babies. Thank you, and I see you next Friday, 1 p.m. Eastern Time.